Welcome to another episode of Timeout with Satva, a short interview series with Ayurveda and Yoga experts. I'm Samya Ramakrishnan. We are continuing our conversation on immunity, and today we have a topic that all you young parents out there will be keen to learn and understand. Building immunity in children. We have with us Dr. Devika Deshmukh, who is an MD in Ayurveda with 12 years of experience, including issues specific to women and children. Welcome, Dr. Devika.
Hi, Samya. Thank you.
Hi, Dr. Devika. So let's begin with basics. From newborn to teens, is there a specific time that's most critical for building immunity?
Yes, there is a specific time to build a baby's immunity or a child that is, developing. And the most crucial time would be from age 1 or right from the time they are born till 5 years of age. So that would be a very crucial time because the child is going to be dependent directly on the mother, on the food that she provides or she gives, first on the breast milk and then on the foods that are going to be more nourishing for the body to grow in a very healthier way.
We hear breast milk is most essential for building immunity in early stages. But for very genuine reasons, like sometimes a child does not get enough breast milk. What does Ayurveda prescribe for situations like that?
So why is breast milk very important? The most important thing that the breast milk can provide is the antibodies directly being passed from the mother to the child. So it is a gifted immunity from the mother which has been passed to the baby. That is how the baby's fundamental system of the immune system will slowly start growing up. But for some reasons, if the mother is not able to provide for the baby, or the baby is on outside food, milk, what the next area of recommendation would be outside milk. So that is cow's milk or formula. If not cow's milk, then going for formula. There are going to be situations where there might be some constipation related issues or health issues, but the immune system here would kickstart a little later. So yes, we will see a little bit of difference where the baby is being breastfed for a whole year, and versus the baby which is not being fed for a whole year or not being able to be on the breast milk.
So with this current environment, I think all parents are worried about their child's safety and immunity. If you have to give one recommendation each for each stage, right, newborn, toddlers, kids or teens, for just taking care of protecting them or maybe building their immunity better based on what Ayurveda says, what would those be?
So let us go with internal care, external care, and then food and habits.
Okay.
So going with internal care, how can you take good internal care right from the baby is born till they are teens?
Right.
So for the first year of life, right from first month till 16 years of age, you can go with a doctor's consult and start with Suvarna Amrut Prashan.
Okay.
Suvarna Amrut Prashan is a very old science which has been mentioned in Kashyap Samhita.
Okay.
Where the baby's memory, intelligence, and immunity boosting, combination, which is of the base of cow's ghee and honey. That combination is given as drops internally for the baby every month. Again, for the first whole year, to strengthen the baby's digestive system, because the baby is going to slowly go from milk to food. The baby's digestion slowly has to strengthen up to digest everything. So a formulation called as Balaguti is what you can easily find out.
Okay.
Then you can start till they are teens or till they are 16 or 18 years of age. Slowly start with Chavanprash.
Okay.
Or Shatavari Gudam or Kalpam. Or you can even start with Ashwagandha Rasayan or Brahmi Rasayan.
Okay.
Now these are some of the formulations which are very good for building the whole immune system of the baby, the intelligence of the baby, the strength of muscular strength of the baby. So these are good combinations to build up good resistance power in a child.
Awesome.
The external care that is the most important here to build up immunity is Abhyangam or going with full body massage. So when the baby is 1 year of age, right from the baby who was born, slowly start massaging every day once till the baby is 1 year of age. So that will be 365 massage. So what does massage do? The main thing that the massage is going to do is it's going to increase the blood circulation,
Okay.
right? It is going to slowly tone the muscles.
Mm-hmm.
And when there is toning of the muscles going on, when there is good blood circulation going on, the toxins which are collected in our lymphatic system are going to be pushed down very well, just to take care of the daily toxins being built up or daily uh, unwanted molecules being built up in our body. Now, this Abhyangam takes care to build good immune system at a very cellular level. While choosing an oil, do go with the seasons. If it is hot out there, it's a hot season going on, go with the coconut oil, which is the basic oil. If it is cold, then go with sesame seed oil. So those are basic two oils. Whenever you're giving the baby or the child massage, make sure the three areas are very well covered.
Okay.
One thing is the head. The second thing is the ears, the external ears, application of oils to that, and then the sole of the foot or the feet of the.
And why are these 3 points important?
They are very important because all three are very sensitive areas, and they also absorb a lot of oils that has been given. Yes, along with Abhyangam, next thing that we can go with is Nasyam.
Okay.
That is going with Dhruta Nasyam. And taking one drop of ghee and putting it in both the nostrils of the child.
Okay.
Internally, applying it internally to the nostrils.
Okay.
Is a very good practice which can be done on a very daily basis.
Okay.
What it would do is it will take care of allergies. It will trap the dust particles, so dust allergies would reduce.
Right.
It will also take care of oleation, so that the baby won't fall sick a lot because of cough, cold, sneezing.
Okay.
And then so when it comes to food, the most important thing is giving a wholesome diet. So
Right.
focusing on all the 6 rasas is very
6 days, include all 6 days. So that is great.
yes.
And these recommendations are for general immunity. Unfortunately, some kids have pediatric issues, and those have to be dealt with like a very specific one-to-one approach, right?
You usually see that there is a pattern where parents come in that our kids are falling ill usually during the seasonal changes which occur during March and April, when
Right.
the season is turning from cold to hot, or during September and October when the season is turning from again from rainy season or the heat to cold. So that is when the seasonal change occurs and the symptoms of our body or our immune response triggers. And
Right.
that is where you feel that the baby is falling sick during those times. So what the parents can do is just before that start with preventive care like Sitopaladi Churna if the baby is or the child is falling sick for cough and cold.
Okay.
Sitopaladi Churnam is good. Palisadi Churnam is good. Arvinda Asavam is good.
Okay.
Along with that, if there are any specific pediatric issues, then definitely consulting a doctor and then going ahead with preventive care would be the best way to go.
So if there's one thing the parents should take away from this video, what would that be?
Okay, so if there is one thing, that would again be one thing internal, one thing external. Go as per the child's eating pattern, not the parents' timing.
So basically,
That is,
when a child is hungry, give a food
yes.
that includes all 6 days, preferably from materials that you have like prepared at home.
At home, yes,
Okay.
and avoiding junk would be something. And then externally is go ahead with regular Abhyangam because its effects are much later that the baby or the youngster is going to experience that and thank you throughout his or her life. So immunity is something that you don't need to worry about. It can be built up as this age progresses of the child. So be calm and build up from right now. It's not never too late.
The immunity is something, if you're born with it, like it's great, but then this is something that can be built based on conscious effort.
Correct. So you're born with an inherent immunity, like you said.
Right.
You're born with an immunity, your mother and father have gifted you through genes, but then there is also an immunity which you slowly develop.
You can acquire it.
Acquire immunity. Perfect.
That is amazing. This is super helpful. Thank you so much for being in this show, and we really appreciate you. With that, we wrap this